Hello, everyone. Good evening. Good to see you all again. I'm Lim, periodontist. I'm really happy to join this live surgery as a moderator. I welcome everyone to the Dentium live surgery show tonight. Thank you for all your support and encouragement. Dentium live surgery show visits worldwide Dentium users twice a month with cases of various topics. Today, just like last time, we invited Dr. Chung to have live surgery. I would like to thank Dr. Chung for his hard work on every Dentium live surgery show. This live surgery show keeps on giving to us, really. Today's topic is minimalism concept applied on immediate implantation. I expect that this procedure will be of great help in your clinical practice. Thank you. Okay, let's take a look at today's case. The patient age is 61 years old, female patient. She got the chip complaint like this. I want to get implant surgery for new teeth. Past dental history, implantation on number 15, 16, 17, and also 24, 25, 27 on upper jaw area. Upper right side received already with bright implant system bone level, and opposite side bright implant system tissue level. Very interesting cases. Past medical history, non-specific. As you can see, this is panoramic view for today's patient. As you can see, lower anterior have a periodontally compromised situation. The periodontal disease involved lower 4 anteriors. And also, 36 first molar tooth have a big defect and furcation involvement, as you can see. So this tooth also will be extracted. And implantation, lower anteriors and molar area. This one is past dental history information about number upper right molar area received a bright implant, bone level implant surgery with the sinus elevation. So using this digital guide, sinus elevation and bone grafting and bone level implant of bright system installed with 3 fixtures and the GBR procedures on number 14 area. So finishing all the procedures and the suture. And the opposite side, upper left molar area, also using a digital guide. And the flapless surgery was done. As you can see, bright tissue level implant fixtures was installed, number 24, 25, 27 area, a flapless surgery. So a slight incision for number 27 area to preserve keratinized gingival tissues. This one is a pre-op CT, cone beam CT view for today's patient. Number 42 and 32 is a very the poor condition, the cause of periodontally compromised situation. And also number 36 areas, percussion involvement situation. So all of these teeth could be extracted and immediate implantation with the gap filling of the socket. And number 37, this site, healed area implantation. So I think very simple, maybe flapless surgery will be done. This one is intraoral view of the patient. As you can see, the crowding situation or of lower anterior. So this one is surgery plan. As I mentioned before, extraction of 42, 41, 31, 32 lower anterior, 4 anterior teeth will be extracted, and immediate implantation with a gap filling procedure on number 42, 32 area. And also extract 36 and immediate implantation, the socket with the gap filling procedure, and number 37, also the simple implantation. All of these procedures combined with the gap filling procedure, and at this time, bone grafting materials will be used, which bone grafting, osteogeno and osteon 3 collagen, and also the collagen graft will be applied. This one is a similar case. This is a similar case, immediate implantation and the gap filling. All of these gap filling will be done on the intact socket, as you know. So extraction and bone filling and drill and implantation, all the same procedures was done. Very simple. Extraction, as you know, and the drill and bone grafting for gap filling, and implantation with the tissue level. These tissue level, these tissue level implant fixtures are very comfortable, especially this kind of narrow ridge of lower anterior or this posterior area also. So 2 implants installed, and the final prosthesis looks like that. What about this case? Actually, more severe situation, as you know. So all of these anteriors, hopefully, so removed. And sometimes need more time for waiting the bone healing, but sometimes we can do immediate implantation, depend on situation. The actually lower anterior is very shallow, the root engaged to socket area, the alveolar bone. So even though the periodontal compromised situation, you can do immediate implantation after extraction. And the extraction first, and drill, and bone fill, and implantation. The similar and same procedure. Very simple and easy. Sometimes we have to use collagen membrane protecting the labial bone plate in case of damaged socket. So this time, as you know, number 42 areas covered by collagen membrane on the labial side. Tissue level implant installed, number 42 and 32 area, and the final lacerations will be done. Okay, so 2 implants supported 4 anteriors. Right, okay. So all of these informations make more comprehensive understanding today's live surgery. Okay, let's move to the today's surgery room. Okay, Dr. Chung is preparing extraction site. So checking the gingival condition. So this anterior teeth, 4 anterior teeth, the floating situation, as you know. So just moving this clavicular area with the explorer, the detachment of the soft tissue fiber, make it easy. Extract of teeth. Okay. Number 41, number 31. The floating situation, so very easy to extract, as you know. And another one. And number 42 was extracted. And number 42 is remaining. So sometimes there's, the percept, the sleeping, the sleep, very slippery, cause of live surgery, as you know. So all of these live surgery have some limitation of side view, cause of the camera angle. So the operator checking the angles of the camera. So sometimes the instrumentation will be difficult. So anyway, the ordinary extractions was done. And after that, generally we will remove the granulation tissues using hand instrument and round bars and lasers and so many other devices can be used after extractions, socket debridement. However, basically the mechanical instrumentation is a basic procedure. Using small round curette or multi-curette, and sometimes we can use periodontal curette, it doesn't matter. Okay, now Dr. Chung, the hand instrumentation, removing the granulation tissues. When you have immediate implantation, as you know, all the granulation tissues that's thoroughly removed before starting the drilling or some another implantation procedure. The cause of, as you know, the periodontally compromised areas, always the can be remaining of the pathogen. So the thorough remove is essential part before implantation procedure. This lower anterior is frequently was done immediate implantation. The cause of site characteristic, as you know, even though the periodontally compromised situation, the shallow root, so it gave us a better condition when we have drilling for initial stability, right? Even though the some of bone resorptions can happen, but it is not the critical part for drilling and getting the immediate implantation and insertion torque. Okay, so all the granulation should be removed. During this procedure, I want to say something about extraction socket healing procedure. You have to you have to keep in mind at the 6 weeks soft tissue wound closure on the socket. Okay, the very important time point is 6 weeks after extraction. It is first the time point, and number 2, the second important time point will be 8 weeks, right? 8 weeks. And then after that, 4 months. It means 16 weeks, also important time point, the socket healing procedure. So between the 8 weeks and the 16 weeks, all the implant procedures should be done because of this, the time period was stable and safe for implantation. Why? After 8 weeks, we can do all the soft tissues. We can use all the soft tissues cause of socket sealing by soft tissue ingrowth. Now Dr. Chung applied the TC, tetracycline application. The concentration of this TC conditioning, 50 milligram per milliliter of distilled water, is the standard concentration, right? Once again, 50 milligram of tetracycline powder with 1 milliliter of distilled water. How much time? During 4 minutes. This one is approved by clinical research. So if you want to apply this tetracycline for the conditioning, the site conditioning, you have to use this TC, the proper concentration with the proper time, 4 minutes. After applying this TC conditioning, to wash out, okay. So unfortunately, the lower angle of the camera, we couldn't see the socket site anymore. So we can imagine from the panoramic view, the CT scan of a preview PPT. Okay. Yeah, these lower anteriors need more the abrupt angle for the camera for full the surgery field revealed. But unfortunately, this time we couldn't have not enough surgical field viewing. Anyway, after this thorough degranulation and then the socket fill with this one is osteon xenograft material from Dentium company. Xenograft. The source is bovine. Yeah, these grafting materials have a higher, very powerful osteoconductivity. I'm packing osteon geno now. Yeah, here is 2 different ways for gap filling. Actually, generally, some surgeons want to have implantation first and gap filling with the bone graft materials after the installation between the socket and implant surface, the filled with bone graft materials. Someone want to have autogenous bone grafting first, and then the bovine, like a xenograft. That means combination technique, like a layer technique. But someone else just using like this bovine bone or some alloplastic bone, it doesn't matter. And Dr. Chung, actually, he want to have a bone grafting first, actually. A drill and bone grafting and insertion. Why? He want to have a more compacting of the bone grafting materials between implant surface and the socket. So like this method, the tight packing can be achieved compared to after packing, right? So always Dr. Chung want to have bone packing first and then installation procedure. So today also, Dr. Chung have bone packing first. Now he is considering of the proper size of fixture. I think the length will be 9 millimeter. So NTI, the tissue level implant, have odd number lengths, 7, 9, 11, 13. So 9 millimeter is like a standard length, and diameter maybe 3.5. As I mentioned always, this NTI tissue level implant is stronger than same size diameter of internal connection, bone level implant, the system. So 3.5, this one is 3.5 tissue level, the same strength, same as 4.0 bone level implant fixture. All the data came from Dentium R&D Research Center. So they have clinical research and experimental research about the strengths. Then they supply the data of the research. And according to that data, this 3.5 tissue level equal to 4.0 bone level implant fixtures in strength. Okay. So Dr. Chung installed 2 implant fixtures. The ordinary position, when you have 4 extraction of anterior, lower anterior, and implantation case, actually lateral incisor, both lateral incisor will be a good implantation point, position. So the 2 implants installed and 2 implants supported for final processes, bridge is a standard and regular type. The cause of lower 4 anterior areas not enough mesiodistally for the 4 implants, right? So tight. If we want to have the same size, even though the smaller size of the implant fixtures, it is impossible to install with the 4 implant fixture. So just only 2 is enough for lower anterior area. Sometimes we have the flip the place, proper position, flip the position of installation. Instead of lateral incisor, we can install the implant fixture on the central incisor area, right? So 2 central incisor with a cantilever, and finally 4 final restoration with the zirconia is also another way to restore lower anterior. Okay, after installation, and this the scanning jig applied. This scanning jig have a dual function. First one, working as a healing cap, and another one, and the scanning jig. We can see have the flat surface on the labial portion of this abutment. This notches working as a scanning jig for intraoral scanning, for positioning. Okay, so after that, the collagen graft applied on the panic area, central incisor, both central incisor area. This collagen graft have a little bit different collagen membrane. So this collagen graft have a much higher compatibility and the soft tissues. They're friendly to soft tissues. They're very higher, the friendly function, the friendly characteristic to soft tissues. It means this collagen graft covered underneath graft materials and also promoting soft tissue healing. Okay, he has another suture knot around this number 32 implant fixture area. Nowadays, Dr. Chung try to have suture the modified horizontal mattress, little bit the modified style. But this time actually the labia will be looks like a modified horizontal suture, but the lingual part just interrupted the suture like. So it is a little bit tricky. Yeah. Okay, anyway, all the sutures was done. This collagen graft cover the grafted site. Today, the graft materials was osteogeno, right? So this particulated bone should be covered with soft tissues and membranes and like this collagen graft. Okay. He want to make another knot, another suture, around number 42 implant area. Also the modified style suture. Okay, that was done. Very simple. This kind of the socket, the procedures, when we have an intact socket, we can do like this style. It means the socket filling, gap filling procedure, right? However, if we have a damaged socket, how can I deal with the damaged socket instead of this intact socket? Yeah, if we have a damaged socket, we have to use collagen membrane with a barrier, right? The ordinary defect areas will be labial site, labial penetration or labial denudation, cause of lower and upper anterior areas have the bundle bone, so easily gone away after extraction, and also very thin cortical layers, very easily bone defect like penetration and denudation. So when we have this damaged socket, the cover the damaged area with collagen membrane, and then the bone fill with graft material like this osteogeno, particulated bone, and also osteon 3 collagen, the collagenized bone. Okay, now number 36 was extracted. The perforation involved tools. So, as you know, the prognosis of these tools very poor. According to the panoramic view and CT view, these perforations degree 3, so very poor prognosis. So it should be extracted. Okay, so all the same procedure: extraction, removing all granulation thoroughly, tissue apply for conditioning. Conditioning means detoxification around this impacted area. Okay, during the conditioning, he will do another implant, number 37 area. He will try, now he is going to try flapless drilling. Okay, so 9 millimeter. Actually, 9 millimeter implant fixtures will be installed. Okay, checking the pass. Okay, after that, now he is trying to number 36 socket implantation for immediate implant surgery. Is osteotomy drilling here. So what about the proper drilling position when you have the molar socket, immediate molar socket? The lower molar have a percussion here, right? So the ordinary type 2 socket is very frequently meet to us. Type 2 socket means the partial, the contact of the host bone. It means the large part of implant fixtures exposed. Just only small part, the half part of implant fixtures are surrounded by host bone. It means type B socket. What about the type A? Type A means whole implant surface surrounded by host bone. This is a rare case on the lower molar area. Type 2 socket is very difficult actually for proper point drilling, osteotomy. So the ordinary, the position will be between the septal bone and mesial socket, right? So almost the 2/3 part of implant fixtures contact this septal bone area. Another 1/3 part engaged mesial socket, mesial root socket area. So you have to consider the proper positioning when you have lower molar immediate situation, right? Then we can see anymore the socket. Actually, just we have to guess the drill and the position because of the camera angle is not enough to see all the surgery field. So sorry about that. Anyway, but we can imagine the osteotomy site. Okay, after drilling, as I mentioned before, Dr. Chung, the bone field first before installation. This time he used osteon 3 collagen. Okay. Another osteon 3 collagen applying on the socket area. And this osteon 3 collagen have almost 10% collagen holding, the 90% of the grafted particulated bone. This particulated bone, 30% the HA scaffold and 70% the beta TCP, so they easily resorb when we apply. And now he installed diameter 4.5, 7 millimeter, 7 millimeter length tissue level implant was applied. This is 36 area. Okay, now he is doing the osteotomy on 37 area. The flapless surgery, flapless applying. Okay, I think the same size will be applied on the 37 second molar area. Okay, the lower speed drill until I think the almost 9 millimeter. If these 37 areas not healed site, if socket, immediate socket implantation situation. Which point is better, the best for the final restoration? Actually, medial root socket site that will be proper, right? The second molar area, lower jaw, medial root areas for proper positioning. And number 36, the between septal bone and medial root socket area, the proper positioning. So we have to consider and we have to keep in mind the proper positioning when you have freehand surgery, right? The why, cause of all the molar and natural teeth, natural dentition have a distalization, right? So that's why. Yeah, I think tight insertions now. I'm not sure he is undersized drilling. He have undersized drilling or not. Anyway, this implant fixture is very tight, engaging the osteotomy site. This phenomenon very frequently happen. Lower bone, cause of lower have the thick cortical, right? Type D2 bone. So now he is going to changing to hand ratchet and tightening with the manual type. Okay, full depth sitting of the fixtures, removing plastic cap. And I think connect with the healing cap. Actually, the official name is comfort cap. Comfort cap, official name, comfort cap. Dual function, the promoting healing, and also the scanning jig. Okay, so yeah, the fixture installation was done. Very nice, successfully done. Even though the freehand style surgery, I think the position and the parallel and 3D dimensional position was perfect. Okay. He will do some of suture knot, make a some of suture knot here. Okay. Yeah. The horizontal mattress sutures will be trying. The lingual side maybe have a little bit modified to making a knot. Okay, so making a knot here. Yeah, it looks good. Okay. Oh, yeah. He also applied the collagen graft too. Yeah, this the collagen graft, the multi-layer product of the collagen. So friendly to soft tissue. So promote to faster healing of soft tissues. This collagen graft was applied on this socket, exposed socket area for covering. Okay. There are many different ways to cover this exposed socket area. We can use wide diameter head, healing cap is another way. And also we can use like this collagenized bone graft materials, osteon 3 collagen. And sometimes we can use the soft tissue graft, connective tissue graft. But today, Dr. Chung is using the collagen graft 2 as a socket sealing material. The simultaneous socket filling with the implantation that was done. Okay, surgery was done. So they are finishing all the surgery. So let's take a break during 10 minutes. And after that, we can have a Q&A session. Thank you for watching. Welcome back, everyone. We can see the Conbeam CT view of today's surgery. As you can see, number 32 was done 3.5 diameter and 9 millimeter bright tissue level implant fixture. Number 37 also bright tissue level implant fixture with 4.5, 7 millimeter. Obviously, looks like a perfect situation, like a digital implant guide surgery. 32 areas, very nice. The well done situation, perfect. Buccal bone plate was very nice, good situation as you know. And also number 36 and 37 was very good done. All of these situations, we have to consider what is the key point. Okay. Thank you for Dr. Chung. Thanks again. Okay. We have a question. Okay. We have a question today. The question is, what is the key point in immediate implant placement on anterior, like this case? As I mentioned before, first, this periodontally compromised situation categorized immediate implantation or not, right? So horizontally deep resolving areas, we have to consider which one is better, the delayed approach or immediate approach. We have to consider. However, like this, today's condition, even though the periodontally compromised anterior teeth, but shallow root involved alveolar socket, we can try the immediate implantation. First, the socket, after extraction, the socket the debridement is very important, as I mentioned before. So the instrumentation, the hand instrumentation is basic. And then adding the laser or some TC conditioning. TC conditioning is very useful, the devices for socket debridement and conditioning. And after that, the proper positioning. But this lower anterior is very simple to proper positioning, make a proper positioning. The lingual socket were engaged, the mediodistal center portion and real, right? So all the procedures will be simple. And the gap filling can be applied. Gap filling means when you have an intact socket, the gap filling procedures can be applied. However, the damaged socket, the socket wall destructed, the labial bone socket destructed or some another place, we need collagen membrane barrier before the bone grafting, right? The key is damaged socket or not. We have to consider the damaged socket to go away this way, and the intact socket to go easier way, right? All these procedures are very simple, and also we can get the higher insertion torque when we use this kind of the bright tissue level implant. Why? Bright tissue level implant have a little bit fatty belly style. It means round dome shape. The middle portion of pictures, the wider than apex and top portion. Fatty belly style. So very easy to get the insertion torque, so higher insertion torque. So when you have around 50, 45, it is enough to immediate loading. So these lower anterior areas, good candidate for immediate loading after implantation. So we can go the straightly easy way, immediate implantation and the immediate loading with the temporization with the PMMA or something else, right? Okay. Thank you for watching. And we have another live surgery show this month, September 16, the Korean time, 7 o'clock p.m. So we will see next time in this September 16. Thank you for watching. Thank you for having me. Bye.